Hey, Greg.
Hey, how are you?
I'm actually coming around here. Processed a lot of the stuff from Japan, and
Got over your jet lag and all that kind of fun stuff?
yeah, a lot of that. The thing that I'm really trying to work with now is the Metatron class, and
Mhm.
it's amazing.
Good, good,
Unfortunately, I'm
good.
a little slow getting through it,
That's
but
okay.
loving it. And took I'm having issues with my psoas. I've had it for years, but it really flared up with the Japan trip.
Hmm.
And I took some of what you said in that class. There were the two um, tonics or lotions that you put on. One
Oh
had an
yeah.
oil,
Yeah,
yeah,
yeah.
and the web protective. Well, I did a salt. I did this today. I've been in such pain, like I'm totally immobilized. I'm not cycling, and getting active release technique applied.
Uh-huh.
And I just wanted to validate some of what you're saying for those others that I don't know. Not anyone, any of your followers don't have doubt about what you say, but um, just more appreciation. I took a salt bath with a CRC,
Hmm.
and you had mentioned that in the Metatron class, as far as I've gotten, and then got out of that and applied the two tonics, one with the oil base, that's the web protective, and the other one that comes first. And I
Hmm.
can't think of the name of it. And then, like, I had to rush off to the ART treatment, and and I reapplied CRC directly on where the pain really is.
Hmm.
Gone.
Oh, good.
Totally
Yeah,
gone.
good, good, good.
And just amazing, because it's been so painful. It's like debilitating, where I wake up crying. So, I mean, I know I'm going to have to reapply and do more applications, but you talked about it in this Metatron class. And I was so excited to be able to apply it to this particular
Yeah.
situation. I had to share that with you. So thank you so
Yeah, I'm
much.
glad you're getting some relief. And the thing with the chocolate root cleanser is, it's a good etheric cleanser and it cleans up the aura and things like that. But it also is a very deep lymphatic stimulant, which, dealing with the psoas, I mean, it's one of the really deep muscles in the low back. But also, like, whenever you're putting chakra root cleanser on, it actually helps increase flexibility in the area that you use it. And, over a period of time, we know a physical therapist that she basically measures these things on the machines with amateur and pro athletes. And she said it's a substantial increase. Like, they'll measure the range of motion and then put it on, and all of a sudden there's a big jump up in that range of motion. And so, it just shows like how intertwined our lymphatic system is with the nervous system, and the ability to like let a muscle kind of relax. And part of it is the combination of things. There's a lot of um, mugwort and artemisia in there to have energy flow. There's hyssop in there that relaxes the diaphragm and the spinal muscles. And one oil that we don't really talk about very much, except for, like, maybe eczema and things like that, is kunzia. And kunzia is actually has been studied in Australia, and their equivalent of the FDA, allows, like, for anecdotal information, especially when it comes from physicians, to be used as, like, you can say this treats something, right? And so Kunzia is allowed, for companies making products and things in Australia. You can say it treats eczema, and it increases flexibility in the muscles around compromised, like, joints or injuries or arthritis, anything of that nature. And so you know anything that where the muscle is starting to, like, kind of cramp up, or like especially when the psoas is tight, sometimes it's a little bit hard to like straighten up all the way or lift your leg up. It should help all of that. It's not going to be the thing that it does it all on its own, but if I remember right, it's protective web liniment body tonic that's in that class. I think so.
Yes.
And then followed by the poplar balsam CO2, which is not our normal poplar balsam. We tracked down like a CO2 version of it, and I made that super strong. So it's very good for the body. It's very good for muscle. I wouldn't say like, oh, you put that on and it makes the pain go away, but it makes everything like function better. And a lot of times it takes like some of my achiness and pain away. So it's one of the things I have like on the nightstand that like, if I'm having one of those days, I throw some of that on. And the combination of all three of those, I mean, I would keep using all that. I would probably do some inhalations with maybe like some hyssop just to try to keep the spine from tightening up so much. The lumbar is a little bit harder. I mean, it can still be done, but sometimes the lumbar is can also be like the knees and the hamstrings. And so I would say even put a little bit of the chocolate root cleanser on the hamstrings, or you use clipless pedals, yeah? Like you're using clipless pedals.
Yes.
Okay, so your hamstrings, especially your lower hamstrings, need a little work and a little maintenance, like just because of it's great to be cleated in on the bike, but it also is hard on that lower part of the hamstring. And so because you're engaging the pedal stroke in a way that's not a way that you would use the muscle any other way. And so you're doing a different kind of motion there. And so marjoram can be good there, but you know what I like to use there is the different peppers, like pink pepper, black pepper, white pepper, the pepper supreme, like any kind of version of that. And I would just rub it on me, like put several drops in your hand and go from like the crease of the knee about that high up, like across that low knee area. And it's not going to fix anything, but it makes things a little bit looser. It releases some of the fascia. It gets more blood going into that area, because what happens over a period of time is that area gets like fascial restrictions, and the blood flow to the short head of the bicep femoris and the lower part of the long head of the bicep femoris almost start to turn, like when you get in there and you palpate them, like if you can, but like if you really dig in there and palpate them, they almost feel like bone. Like they get so dense, because they're such a strong muscle. They can get really, really super tight. And the way to check that is, boy, I'm going on a tangent. Like, well, might as well.
Well, I hope other people appreciate it, because I'm loving it. Thank you.
So the way that you can really tell when you have when you're starting to have a little bit of an issue with the hamstring is like when you're standing and you're not really thinking about it, and you're standing, for you to like stand and be relaxed, your legs are a little bent. You know what I mean? Like the knee is a little flexed. Like you don't stand with your leg completely straight. It's like you flex them a little bit and you go, huh. Like when that starts to happen, you are having issues with the hamstrings. Like speaking from personal experience, like it is like it needs to really be treated. And eventually what happens is it starts to impact this little muscle behind the knee that kind of comes up and around the knee. And it's what initiates the movement up. And so cyclists, soccer players, and tennis players are especially prone to issues in this little muscle. And eventually what happens is it gets irritated and it starts to blunt the back end of the meniscus. And so it doesn't tear anything, but it just starts blunting off this little piece of the meniscus. And, you know, over 10, 20, 30 years, it starts to become a bit more of an issue. And so the more that you can keep blood going into that back area, it's almost like preventing a potential injury. It doesn't mean that you're going to have an injury, but you start to have like a greater potential for an injury there. And so usually it's like low back, like an SI joint or a psoas issue. And I would say everybody has a psoas issue. It's just to what degree. But cyclists can be more prone to a psoas issue. Definitely. Like, again, soccer players, tennis players, sometimes golfers will have issues, but usually with a golfer, they only have an issue on one side, where like the other ones, it's usually unilateral. And so, yeah, you just do some maintenance on that. I mean, I don't think you need to stop or do anything, but, you know, make sure you're always fit on your bike really well, you know, not too hunched over, not too way too high up, and leg extension is good, you know, all the stuff you already do. But yeah.
Well, it sounds like we need to get you on a bike soon.
I don't know. My doctor told me no more of that like long time ago.
Oh, okay. Thank you so much.